Hey, 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 what's going on, everybody? It is Dr. Alexia. I am the medical director of BRCA Strong. BRCA Strong's mission is to educate and advocate and empower and provide financial assistance and resources for women who are at risk for breast and ovarian cancer or experiencing breast or ovarian cancer, regardless of their genetic risk or predisposition. I am filling in for our wonderful founder, Tracy, today. Tracy is at home recovering. Hey, Kate, how you doing? Hey, Just Moon, how you doing? And so tonight we are going to be joined by Coach Casey. Coach Casey is an amazing, amazing woman. She is a BRCA2 pre-survivor slash survivor. She is also a American Ninja Warrior, and she is most a health and fitness coach. So this evening, she's going to be sharing with us her amazing journal, Lord have mercy, her amazing journey. Hey, Casey, how are you? Hey, welcome,
Hey.
welcome.
There we go. Hi. Can you see
Hi, how are you? I see you.
me
Bring your
okay
camera up just a little bit because it's like cutting off the top of your head.
like that?
Yeah, there you
So
go.
weird. I did it on my phone and I've never done this before, but here we go.
Listen, you're on here, you're doing it live
Yeah.
and in the flesh. So, Casey, please do introduce yourself to everyone who's joining us on the live. Tell us more about your story, your pre-vivorship, your survivorship, and we'll take it from there.
Well, thank you guys for asking me to be on here. I'm very much an advocate for sharing my story because it like it's shocking that this stuff is so real. Like I already feel like I'm gonna get emotional because you know um, mine is done, and basically I'll go back. So everyone in my family has the BRCA2 gene mutation, and growing up I've watched one by one they all got diagnosed with breast
Wow.
cancer and ovarian cancer as well. But back then people they knew well enough to go ahead and get a hysterectomy preventatively. And so when my mom got breast cancer 12 or 13 years ago, it was like, okay, well, let's check your family for this gene. And go figure, the day she got the mastectomy, my results finally came back saying positive. So,
Wow.
and it was like something that, like, it was like, whoa, like this is too much. I was only like 27 at the time. And
Mm-hmm.
then I started getting monitored. They started doing the mammograms and everything. And I went to I'm in South Florida, so the Miami Silvestro Center. And it turns out that my whole family has this gene mutation. And basically, like, here's what you can do. And I wasn't ready to process it yet. I thought
Mm-hmm.
I still had time because in my family, the onset of these things have only happened after midlife, like 50, I think,
Okay.
if somebody got it.
Mm-hmm.
So I thought I had time. And then I remember I do a breast cancer fundraiser every year. I used to. It's been kind of crazy, but um and I was packing up goodie bags and I got the call that they found something. And I had to go into knee surgery at this time because I tore everything in my knee doing sports.
Oh
And
boy.
yeah, and so when I had that scare and I went in to go do the MRI biopsy on whatever they found, I don't know how many people have had that, but that is such a painful procedure.
It was the most painful biopsy I had. I've had a bunch of them and it is really painful.
Yeah, because you're face down, they're smushing it, they're poking it.
Mm-hmm.
It's just like you're crying because it's just scary, and you're just stuck in this machine. And my tissue was compromised, but I knew that regardless of what the results, I was like, let's just do this. I'm going out from knee surgery. Let me go ahead and knock out this surgery as well because I'm a coach. I'm going to be out.
Mm-hmm.
And so I faced it, and I went ahead and had everything removed, and I went straight direct to implant. Now, back then, this is 2012. So this is
Okay.
before Angelina, this is like right before Angelina Jolie came out. So
Hmm.
didn't know anybody, anything, wasn't a part of any groups at the time. I was just like, this is what I have to do. People thought I was nuts.
Yeah.
Okay. And this, I
Yeah.
mean, I'm sure it's come a long way, but people really had opinions about it. And it's like, I
Hmm.
was too scared not to do it. I didn't see myself as brave. I thought like this is inevitable. I need to take care of this. I don't want to be scared the rest of my life, because the other
Right.
thing is people that are just being monitored, there's always that scan anxiety where now I
Hmm.
got to go back. Now I got to wait for results. Like, and now even with COVID, it's so much worse because you got to do it by
Yeah.
yourself. And
Yeah.
so um, I had my removal, but the thing is, mine paired up with knee rehab. My doctors were all aware of each other, but somewhere along the line, they told me to run too soon. And my
Oh.
tissue had already been compromised from the MRI biopsy. That I was taking daily pictures to make sure, because I had a wound and the wound kept getting worse. And my doctor's like, it's going to get worse before it gets better. It's healing. But then when I took a picture and I noticed like a lot of shine coming back, I was like, that's my implant. And so
Mm.
basically, and I documented all of this on my YouTube because I knew that I didn't find anything, and I wanted to be able to share that with somebody, could
Yeah.
put that out there. And so the doctor was like, just come to my office. And so I went to his office, and he's like, your implant has to come out. We could do it now or at the OR tomorrow. I was like, what do you mean now? And my doctor had worked on the front lines as like an army medic. So I
Wow.
trusted him to do that. So he went ahead, didn't feel a thing, just like,
Yeah.
just like cutting away the wound, pop in the garbage, and then I just had to walk out. And it was like, I remember
Wow.
my dad has always been there for me for my recovery, and he knew like I had to cry because I look down, I see a wound the size of my fist in my chest. And like,
Yeah.
granted, I didn't have cancer, but I experienced a lot of trauma with this situation, because I think anybody looking down at their body and seeing such a wound,
Right.
it's insane. And I had to have a nurse come and pack that wound a couple times a day, and it smells and it was gross. And then I remember just thinking like, I did this to myself. And that was
Oh,
the
wow.
yeah, like, because
Wow.
it's like, what was I thinking? Why did I, like, like, you go every which way. Because the one thing that I want to express to people is that if you are looking into this stuff, consider your mental health first, because nobody told me to, talk to others beforehand, or like make sure I was seeing somebody to talk about it after. So now that I'm in this uniboob situation where I had to like let the tissue grow back, and it was this side was fine, but I had to start with the expander process again. But I had to
Hmm.
wait 7 months for that tissue to be okay, and
Yeah.
then going back into surgery 3 more times, um, just for that was, and I had a limp. Like I was just a shell of myself. I was 29 years old, so I was
Okay.
last year
I was getting
before my
ready to
30th,
ask how
and I
old you were.
was down, and I didn't want to be in fitness anymore. I felt like a kid in a candy store with diabetes, is what I used to say, because like
Mm.
I'm teaching people to do things that I don't even know if I'll ever be able to do myself,
Right.
because you have to play it smart in your recovery. And so if you're going through all these surgeries, like, just be patient. And so I was my best. After that, I was my best client, and I actually ended up developing a program to help women in this situation, because what I've learned is that doctors want to protect the integrity of their work, but
Yep.
so they're going to tell you like, don't move, which
Hmm.
isn't the right thing, because
No.
then you'll develop range of motion scar tissue issues, which you might have had as a breast cancer survivor. A
Hmm.
lot of people that have had breast cancer have residual issues for a long time. I've worked
Yeah.
with a lot. So I wanted to develop, even though I didn't have breast cancer, I wanted to develop something to help people through the surgeries. And so that's called Fubi Fitness. I haven't had time for the nonprofit in like a couple years now, because I owned a gym and had kids. But the videos are still there on YouTube, and it starts day one in the hospital. You got to kind of like just release your neck, just do what you can.
Hmm.
But fast forward, you know, almost 10 years later, I decided to go ahead and remove everything, total hysterectomy. And I thought I
Mhm.
was doing that early again as well. And it turns out that I actually had a rare cancer in my uterus that was caused from this last pregnancy. I was only 5 months postpartum. And
Wow.
I was like, you know what? We know we're not having babies. And that's kind of why I did have a baby, because my doctor was trying to say, listen, we got to get I was having scares. We got to get your stuff out. And
Mhm.
I wasn't ready. And I was like, I'm going to have another baby. And so let's just go ahead and have another baby. And freakishly, the pregnancy caused the rare cancer that I have. It's not uncommon for gestational cancers to happen, but
Right.
um, it's just, it's very interesting. And unfortunately, I went in thinking, okay, like, yes, I'm free from all of this. And then 2 weeks later, I did not even consider the pathology reports were going to come back and tell me that that's
Right.
a rare cancer. So I've worked my whole life to avoid a cancer diagnosis. I've done everything, and I did these, and it was just like the wind out of your sails. And it's taken me a really long time to like I'm not healed emotionally. I know that.
Mhm.
I think with the pandemic, we've all had a lot harder of a time because everyone's going through something. So you got to be there
Yeah.
for yourself, number one. In
Yeah.
your recovery, you got to put yourself first and take care of you. It is a job. You can't look at that as like the surgery is a finish line. No, that is
Mhm.
like how I look at it is competition. Like as an athlete, like the game time. We need to
Yeah.
hydrate. We need to make sure our nutrition's good. We need to set up
Yep.
for success.
Yeah. And you use the word heal, right? That's so important that you went into this, or you figured out along the way that you were responsible for healing yourself. And I think that's something that we as cancer survivors or previvors, or anyone who's dealt with any major life-threatening or chronic medical condition, we sort of miss. If you don't come to that epiphany or enlightenment on your own, doctors cure or treat, but healing is your work. You may need some help. You may need to enlist some professionals, and those professionals may be from, so many different areas, expertise, and arenas, right? So it may be your physical healing. So we're hiring a coach like you that can get us through the fitness aspect of it.
Yeah.
We have to heal our mindset and our emotional state. And that, just like fitness, is a lifelong process. It's an ongoing process. And you may need a therapist or a mental health professional. It may be enlisting the help of community and finding people who you relate to and connect with. Because it's hard, like you mentioned, right? You did this in 2012, where, I don't even think I knew what YouTube was in 2012. I certainly wasn't on Instagram, and I was barely
Oh
using
yeah.
Facebook.
Right.
And I remember in 2018 getting diagnosed and looking for women who look like me and that I related to, and not being able to find anyone. So I can't even imagine what it was like for there not to just be a community that you don't necessarily fit exactly into, but for there to be no community and having to heal, and not necessarily being readily able to find women your age in your circumstance with small children, because that's something that I'm also a stand for, moms with young children going through
Yeah.
um, you know breast cancer or breast cancer
It's
risk.
hard. It's hard on your children too, and that's another thing.
Hmm.
Like I couldn't even hold my baby or take care of my kids by myself independently, you know, for the good part of this year. I mean, thank God I went into another surgery to check my lymph nodes, and those are okay. I still have to be monitored.
Right.
So the other thing is like I don't. It's hard to label myself as a survivor because I didn't go through what you went through and the struggle of, you know, fighting the cancer. It was out of me. I had a little short epic battle, but the fear of there possibly still being cancer is still there. and
Yeah.
and that's the thing is like, I think for me anyways, I try to be so strong, and you put on a brave face because you do have kids. They can't see you just breaking down, and it's a good reason to get up out of bed. But um it's you have to be there for you and schedule self-care. And
Mm-hmm.
for me, that is 100%, and it should be for everybody, is some form of exercise. Like, you don't have to have a plan. Just go in there, put some music on, get your mind right, and move a little bit, you know?
Yeah.
It starts so small with just walking, stretching, range of motion. I mean, for the first 2 weeks, you're just really focusing on just stretching and walking to get your bowel movements even going, because that's something they don't tell you
Yep.
about.
Yep.
Like, pain of like the gas, and the I think one of the goals for everybody should be to get off pain medicine as soon as possible, because between the anesthesia and pain meds, in terms of like the narcotic ones like painkillers, those will really slow down your gut and
Yep.
motility, that it just causes all different types of other pains. So that is a goal that everyone should have, as far as like post-op, within, you know, it, and just setting yourself up for success and making
Yeah.
sure that you do your research and know how you are going to possibly need to move through this healing process, like you said.
Yeah. So what did that look like for you? Like, what steps did you take, and what was it not being able to hold your baby, or was it just, having a particular physical goal in mind? What was it that pushed you to say, all right, I'm not going to sit around, I'm not going to take these meds and deal with these side effects. I'm going to rehab myself and I'm going to heal. Like, what was that push? And then what did it look like in real life?
So, I mean, I've always been a very motivated person. I mean, I do this for a living. So like I said, like, I actually have a background in recovery. There's a lot of things that I could do, like, there's no reason that I would never tell people to do certain things that I do. But because I am constantly working at recovery, it's always an ongoing process every day, whether you just had surgery or not. You need to be trying to work at combating inflammation in your body, because
Mm-hmm.
all these environmental exposures and just even exercise is a form of stress on your body, and then you have actual stress, all those things, and like poor nutrition just adds to inflammation. So you got to have proper nutrition, which basically is pretty simple if you can just understand that you just eat what's on the earth, like, it doesn't, like, diet free, sugar free, fat free, like just stay simple ingredients and you're good, and you will get all the nutritional value that you need. And just do a little research. Like, I'm not going to promote any supplements, but for me, CBD oil really helps my inflammation, because I also have rheumatoid arthritis. And also, drinking collagen powder or bone broth, something to help with that recovery and tissue repair.
Mm-hmm. Yeah. Absolutely. I definitely, if I'm not eating anti-inflammatory foods or drinking my tea, which are teas, and adding anti-inflammatory and rich antioxidants to it, like citrus fruits and turmeric, like somebody mentioned, then yeah, I'm taking my anti-inflammatory
Yeah.
supplements, and or both, because it's definitely one of the root causes and contributing factors to diseases. For folks like us, um, regardless of all those other things, we might have still ended up with cancer, right? Even if we did all of those things. But yeah, as a healthcare professional, I know that you can, stave off some of these things. You can decrease risk of other cancers and other chronic medical conditions, by managing your own systemic inflammation. And yes, exercise is a way to detox and rid the body of inflammation. And I think it's something that's really overlooked.
And promote healing as well. Like, you just have to look at circulation in general. And the
Mm-hmm.
thing, the thing that people don't also consider a lot of times with recovery is, like, yes, you need to rest, but if you're resting in poor positions, that's only
Mm-hmm.
going to make your body hurt in different ways. Um, and so you got to make sure that you're sleeping right, and that you have plenty of pillows. Like, even one of the things that I forgot to bring to this last surgery for my, I had the robotic surgery for the hysterectomy, but I didn't have anything to cover the seatbelt when I left the hospital. And
Yeah.
like, I know better because I needed it for my chest, but I just didn't even think. So, just kind of going over all those things and setting yourself up for success, making sure that you have the help. It's very hard to do much, especially, I think PBM was a much harder recovery.
Mm-hmm.
Um, I don't know about everybody else, but honestly, I think we all put a lot of fear into removing our ovaries and, you know, starting that like, oh, it sounds so scary, the menopause. And it was scary, but I will tell you that I feel great. You know, it was so minimally invasive. And that's the problem though, is the scars aren't on the outside, but you still have to remember that you're healing
Mm-hmm.
on the inside. So, just always trying to take care of yourself because
Yeah.
nobody's going to do it for you. Nobody's going to force you to eat those things. Nobody's going to make sure you walk and stretch. Like, you have to get yourself motivated, whatever that takes.
Yeah. I think it's so important to know what you need to do and have the mindset that I'm going to do this. Because I remember after I had my bilateral mastectomy, and 3 weeks later I started chemo. um, I was grateful for all of the help. I absolutely needed it. My daughter was 6 at the time. I needed help taking care of her, and everybody pitched in. But all the folks in my house kind of like wanted to coddle me, and no one wanted me to do anything. They wanted me to just lay and rest. And I'm like, no, absolutely not. Like, that's not good. And in fact, it can be dangerous to just
Yeah.
lay in bed all day. You're
Yeah.
in an, healing is an inflammatory state, and your post-operative state is, again, inflammatory, and it predisposes you to other complications like blood clots, constipation, that you already mentioned. And it delays the inevitable pain that you're going to experience once you start um, moving. And so the sooner you get moving, the better. But people will want you to lay down and rest, and will bring everything to you instead of encouraging you out of bed. And I think about, how different it was like when I had my daughter. She was born by C-section. And I remember feeling like they were dragging me out of bed, in the postpartum unit. Like, you got to walk, you're going to get up and go around down the hall, around the corner to that nursery and get your baby. We're not going to keep bringing her to you. And it was like not even 24 hours out. And recovering from the mastectomy, it was like my family and my boyfriend at the time were like insisting I stay in bed. And I'm like, no, I gotta move. This is not at all what I would tell my patients to do. I wouldn't tell them to just lay in bed and to give into this process, this disease state, this surgery, but like to fight for your recovery. So what would
Right.
be some specific tips and tricks you would give to any of the ladies or folks on here listening who might be recovering from surgery, planning a surgery in the near future, or maybe even doing like a little prehab before going
Yeah.
into surgery?
So I actually put some goals up here that I'm gonna look at as I talk to you. So the
Okay.
number one goal is set yourself up for success. That's what we call the pre-op prep. So making sure that if you're gonna have wounds, that you have all the gear that you need to address those wounds. That you set yourself up with help, like you said. Like if you have pets, you can't be walking them right after a mastectomy. So and setting yourself up, making sure that you maybe pre-cook some meals and store them away, have everything handy to you. Making sure that you hydrate is huge. A lot of
Yeah.
people underestimate how important it is to have hydration. There is an electrolyte gradient of sodium potassium on every single cell in your body.
Yep.
You need them. So coconut water is fine, something like that. I'm not for the the Gatorade or anything like that, but there's plenty of other products out there that don't have so much sugar, because sugar is inflammatory, right? The other thing is, as part of pre-op prep, is the self-care. So
Mhm.
whatever you need to do to make sure you can relax your anxiety, and like after my last surgery, one of the things I did is I put on my F cancer playlist right away, because I knew that, like, coming out of that surgery to see if there was still cancer, I would not be in a good state. So um, get your playlist, your boss bitch playlist, so you get your mind right, and
Yep.
you got to put those grooves on that make you feel good. It's very easy to slip into that recovery state and just stay there, and that's not good for your mental. If you're just sitting there watching things all day long, yes, okay, 1 or 2 days, sure, but like, you got to get up. It's my husband actually sent me out of the house to go get coffee one day, because he knew that it had been 2 weeks. I was still scared to drive, you
Mm-hmm.
know. And the other thing is clothes. Make sure you got to have loose fitting clothes if you're going to take
Yes.
care of yourself, especially if you're by yourself. You don't want to be putting shirts on. You got to have some button ups for your mastectomy. You got to have loose pants for your hysterectomy. And that the loose pants thing I think was like 4 weeks, like it because it's like 5 little incisions, so
Mm-hmm.
just it's right across where your waist is. So
Yeah.
so that's your goal number one, pre-op prep. Goal number two is comfort post-op, because you need to be able to come home, like we said, have loose clothing, extra pillows, make sure you sleep right, because one of the things I think people undervalue is a little bit of elevation in your sleep. It just helps with
Mm-hmm.
circulation. So especially if you just had a mastectomy, having to lay flat and then get up is going to hurt. So if you can kind of just stay a little bit inclined and then you
Yep.
can just roll to your side, would be much better. It's just easier to get out of bed that way anyways. With we already talked about this, but with a goal of comfort is also getting off of the pain meds when you can, easing off the painkillers at least, because you need to have a bowel movement and you need to make sure you have some stool softener and maybe even a laxative on hand, because that's just the way it is with surgeries. And that doesn't go away for like 2 weeks sometimes. And that is very painful. I'm going to show you a tool that I have. So this is one of the tools that I like to use because we're all on our devices all the time, but especially mastectomy. Your problem is these muscles between your shoulder blade, they get so weak and lengthened, and then they also get tight. And so you need to be able to like dig at them or whatever. This is a good one for trigger point release. So things like this that can help you just get those knots out of your body and just function better. Those knots are just tissue that just needs to get some blood flow in there. So that is goal number two, comfort.
What is that called?
And,
The tool you just showed
oh,
us.
this is called a Back Buddy. It's on
A
Amazon.
back
It's like
buddy.
25
Okay.
bucks. It's so good because I'm not using any strength to do this. I'm literally just like kind of using it as a lever and just putting it right into my shoulder blades.
Yeah.
So you'll notice a lot of times mastectomy people, that's the thing, is we get protective and we go tight,
Yep.
real tight here.
Mm-hmm.
And so our rhomboids just really need to be pulled back. That is one of the goals with movement, is down the road. So goal number 3 is movement. You need to be able to walk, do a little bit of range of motion, stretching, and trigger point release to help the overall functioning and healing of your body. By week 2, I say you could start really exercising by week 2. There's no need to rush. I mean, I'm an exercise fanatic, but I even gave myself 2 weeks to just focus on walking, stretching, range of motion, and just overall release. The last goal, of course, is to make sure that your nutrition is on point to decrease that inflammation. We've already said it. I'm a big fan of CBD oil and other supplements like bone broth, or even just adding turmeric into things, making sure you got cinnamon in your oatmeal, get some smoothies in your life. Find ways to include anything you can to help inflammation. Stay away from post-op. It's too greasy, it's inflammatory itself. So just make sure that you really focus on eating healthy and no alcohol, limit sugar, caffeine, like all these things are just going to delay your process. And the last thing you want to do is possibly rush through it and get set back.
Yeah. That's right. No setbacks. No setbacks. So over the course of your healing, because you were healing from 2 surgeries at one time and 2 major surgeries at that. And then you did the ninja, you completed the Ninja Warrior after those surgeries?
Oh, so yeah. Well, oddly
Okay.
enough, I never thought I would be an athlete again. I really wondered this because I didn't have somebody to look to for that. And so I shared my story with Ninja Warrior because there was that girl Casey, and everyone was like, "Casey, you should go." And I was like, "Whatever." So they liked my story and they shared it. I didn't do so well on that course because there was like a big obstacle I couldn't even wrap around, and I just got flung off. But that was within a year after having 5 surgeries in 1 year. So, God or life in general just moves quick. So I know when you're like deep down, because I've been there, like when it's dark, it's so dark and you don't see the way, but it's not going to be like that forever. And you just have to believe and stay strong and have faith and do things that make you feel good, to have a positive attitude. I say armor up with positivity. That's my new thing,
Yeah.
because
Yeah.
there's too many things to get upset about. You got to like kind of choose it.
Yeah. Right, exactly. You know, certainly we don't want to be toxically positive, but I am definitely someone who is a fan of, positive mindset, positive life, or, choosing gratitude, being in the practice of gratitude, because sometimes so much can be going on and going wrong that it's hard to see what is going right. Sometimes you have to seek it. You have to look for it, or you could just decide, today I'm choosing joy. I don't care how much pain I'm in. I don't care if there's nothing specifically to be happy about. I'm choosing joy, and that's what I'm gonna ride on. That's what I'm gonna roll with. And sometimes that's just the very thing that carries you over. And I'm sure after your experience and so many different setbacks, you can totally attest to that.
Yeah, I mean, and I hate to say it, but it is true. You can fake it or faith it to make it,
Yep.
because sometimes just trying to put on a brave face can actually help you and getting your mind off of it.
Oh
But
yeah.
it's the other thing is, like, you have to realize what triggers your anxiety and fear and like feelings of sadness. Like if you're going to scroll on your phone and get upset seeing
Yep.
people doing things that you can't do, or that you're laying in bed and everybody else is having so much fun, do not go on your phone. Don't watch
Hmm.
the news if it gets you anxious, like, so find out what your triggers are and just try to focus on things that are going to keep you in a healthy and happy mindset, because that is going to help your healing.
Yeah, absolutely. Absolutely. I totally agree with that. So let's see. Look at Susie says, I watched your YouTube videos. I coached myself to prepare for my prophylactic bilateral mastectomy, and now I'm training to be a life coach. That's awesome.
Aw, that's
Look
awesome.
at that, Casey. And that's the best thing, right? That's the most amazing thing, when on the other side of all the things that you went through, when you find yourself in those moments of why me, or woe is me, why did I have to go through that? And it's because somebody else needed your light. Somebody else needed to see your videos, Casey, so that they could prepare for their own surgery and prepare for their own journey. And that's amazing.
I think it's important for all of us to share, because you never know who, like, I've gotten private messages that, like, so many, that it's just, it helps other people to see somebody else go through it. So share your story, everybody. I can learn from everybody for sure. I don't know everything, so that's why I would love to see everybody be able to share something, because it's brave to take it on. And maybe other people don't have BRCA mutations, but there's something else that they need to face themselves. So whether it's the same relatable like wavelength or not, it helps to share in your healing as well. I realize that bottling things up, um, like sharing and helping other people, is part of my healing. That really helps me.
Absolutely. Absolutely. Though that sharing, every time you share, it gets a little easier, or you recognize something else that is still painful, or still giving you some discomfort, and something you need to work on, or you recognize your healing in that, oh, I was able to tell this story and I wasn't angry, or I didn't cry the same way I used to, or now my tears have been transformed to tears of joy. And you get to recognize your own healing, while you're healing yourself, and sharing your story, and then sharing and working through that process. So that's really cool and really amazing. So what other, do you have other tools that you want to share with us, Casey?
I have a simple one, actually. This is a lacrosse ball.
Mm-hmm.
So it seems silly, but like, if you can notice, like, pain in your body should never really be ignored. So if you have tight shoulders and stuff, ignoring it is not going to help. So these tools are for trigger point, and that's something that will be able to allow you to go into better range of motion with your muscles. So just like honestly, this one I use it in my glutes, so you can kind of put it on the floor and like sit on it and just move around, put it under your foot, under your hands, behind your back. But anything like this is going to help release that and allow you to get that better range of motion so that you can get better movement.
Yeah, so that's pretty awesome. You're basically sharing how we can give ourselves a really great massage, almost
Yeah,
like a deep muscle releasing massage,
it's what
because
it is.
yeah, I
Because especially sitting down all the time, everybody could use this in their butt cheek. I'm telling you, because we get tight just sitting and doing nothing. I don't know about you guys, but especially because my rheumatoid arthritis, if I don't move, my body is just not okay. So and I'm saying movement, like I don't exercise every day. I'm saying stretch, walk, range of motion. That is and the thing is, guys, like what I'm saying and what I'm sharing is that I've also somehow had these surgeries this year, 2 surgeries within 6 weeks of each other. And then, you know, a few weeks later, I'm back to racing and I'm actually on the podium. And I think it's not because I went back in and I went hard. It was because I allow myself to listen to my body and recover properly. And I'm still recovering from the race the other day. So just listen to your body.
that's amazing to hear that after all of that, you're still racing. So that's good. So Sonia has a question. She says, I had a bilateral mastectomy in October of last year after 8 months of chemotherapy, and then a hysterectomy 5 weeks ago. What is the best exercise you would suggest to get going again?
Well, walking is always number one. I don't think right now that you should be doing impact just yet for the hysterectomy. It depends on your fitness level, obviously, but if you can walk and just even if on a treadmill, an incline walk, it'll give you that little extra effort that you need to feel a little bit more of a workout without putting you in a bad place with your joints and your healing right now.
Yeah. Yeah, walking is great exercise. It's
Swimming
good.
is also really great. I don't think you could do it just yet though, but if you can get in a pool, I mean, you're against resistance in all movements, so anything you do in the pool is going to feel good. But I do have the videos again on YouTube that this is 12 years ago, but it's still the same. It's like the mastectomy, working on your range, it's showing you range of motion stuff. I actually want to work on a video for hysterectomy because like I said, I think it is a little scarier somehow. It was for me anyways, but the recovery is much easier.
Awesome. So let's see. So Wicked asked if either one of us was BRCA1 or CDH 1. So Casey is BRCA2 and I am a PALB2 mutant, which has a lot of similarities and follows a very similar treatment and screening path as BRCA2. And then of course we know BRCA1 and BRCA2 are very closely related, same screening, same prophylactic surgeries, with just very minor nuances between the two. So I would say maybe connect with either one of us, Wicked, as well as check the BRCA Strong website for any information about genetic cancer risks and see if your questions might get answered there. So we're going to close out, Casey. What do you want to leave all of the wonderful ladies who've been rocking out with us over the last 40 minutes with? Like, what would be your best piece of advice?
To just really stay strong in your mental attitude, because it is your attitude and your approach to things determines your outcome. And so
Mm-hmm.
that's why I said just do whatever you can to cultivate peace, and just anything to self-care, help you relax, help you be positive, and help you not be so stressed, because stress will do things to your body.
God, yeah, that's such sage advice. Mindset is everything. Mindset is bae. I was I don't remember who I was talking with, but I was talking to somebody today and I was saying how, you can have the perfect regimen. You could have the perfect surgery. You could have everything lined up in your favor. But if your mindset is not accepting that you're going to have a favorable outcome, you know, wherever your mind goes, your body is going to
Yeah.
follow. And so you could have the cure. You could have, you know, a completely uncomplicated surgery and everything did what it did and, you know, was supposed to do and still feel physically terrible because you're manifesting physical outcomes based on a negative mental space. And so you know, such sound advice that you are giving in terms of, you know, start with mindset. Where your mind goes, your body will follow.
Absolutely. There's only one of you. You got to take care of you.
Yeah, absolutely. So Wicked definitely connects. So I have two mutations also, or at least one mutation and one gene variant, and that can sometimes be tricky. But you want to make sure you're in the right care setting when you have that kind of you know, unique genetic pattern where you have kind of dual risk or, you know, competing risk going on. So Casey, any final words beyond the mindset? Tell folks how to reach you, how to connect with you. Again, just reiterate your YouTube channel, where to find information, and then we'll sign off.
Yeah, Coach Casey, OCR Ninja. You can find me on Instagram. That's where I mainly am, is on Instagram, I guess. But I'm going to be posting more on my YouTube, which is also Coach Casey. And if you look under my playlist for Coach Casey, I created the playlist for my mastectomy journey and recovery for into those exercises that will help you guys.
Awesome. Awesome, awesome, awesome. Thank you, thank you, thank you.
Thank you.
Casey, we so appreciate your time. We
I
appreciate you
appreciate it.
sharing your story. We appreciate you sharing your resources and just giving us things that are very doable, very tangible, that are going to give us very real and very powerful results. You are a warrior. You are a survivor. You are
How are
a
you, baby?
thriver. You are all of the things, girlfriend. And, you know, just because you didn't have to go through chemo or something that I or somebody else might have gone through, it doesn't make you any less of a warrior. It doesn't make you any less of a survivor. So pat yourself on the back, girl. You have been through some things, and on the other side of it, you are still a stand for the health and wellness of other women. And that is incredible. So thank you so much for your time.
Thank you.
Everybody who joined us on the live tonight, thank you so much for your time, your attention, your questions, for your feedback. Wicked Astro Wolf, shout out to you, 6-time cancer warrior. You definitely have a story to
Wow.
tell, and I'm going to find you and connect to you with you because you will help other people as well. So I'm Dr. Alexia, triple board certified infectious disease physician, mom, speaker, author, cancer wellness coach, breast cancer survivor, thriver, and medical director for BRCA Strong. We look forward to seeing you all on the next live. Everybody have a wonderful night. Take care.
Bye. Thank you so much.
Bye. Thanks, Casey.